Good afternoon. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, Stephen McNeil, and the Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Chrissy, and good afternoon, everyone. We are here to report one new case of COVID today. This case is related to travel outside of Canada. The individual is not a Nova Scotian, but after flying in from the U.S. to Toronto, they were cleared by Canada Border Services to board a flight to Halifax. There are signs posted all over Halifax Airport, and our own provincial officials are there to provide information about the current state of emergency in our province and the requirement to self-isolate for 14 days if they are coming from outside of the Atlantic bubble. Those arriving are also given a brochure to explain all of the other public health protocols. This individual was passing through Nova Scotia en route to PEI. Because this falls under federal jurisdiction, the individual is now being quarantined in Nova Scotia under federal authority. This case, along with a number of reports of people from outside of the Atlantic bubble coming in and not self-isolating, has sparked a lot of questions and concerns about the Canada-U.S. border and about our own border. And I am as frustrated as all of you. We have worked hard together and sacrificed so much in this province to help flatten the curve, only to have some people come into our province who think they are above it all, who think that the rules don't apply to them. Guess what? They do. We have reached out to the Canada Border Service Agency to get a better understanding of the federal guidelines. We understand Canadians who want to come home, no matter where they are living in the world, can't be turned away. But once they get past the federal border and arrive to Nova Scotia, then our rules here in our province apply. Our border agency are providing information around those rules, specifically the 14-day of isolation requirement. But clearly some people who say that they will be self-isolating but aren't. And they are putting all of us at risk. And this is not acceptable. So anyone coming into our province from outside of the Atlantic bubble must provide the address where they will be self-isolating and a phone number where they can be reached 24/7. If they are in self-isolation, they should be able to take a call. Tomorrow, a form will be available on the Nova Scotia Corona website. Anyone from outside the Atlantic bubble must fill it out and present it at our border with a phone number where they can be reached, and that will be follow-up calls every day for 14 days. And if we can't locate them after 3 tries, police will be called in to do an in-person check to make sure that that person is self-isolating where they said they would be. What I am talking about here is not connected to the Atlantic bubble. We just opened it up on Friday, and we had a good weekend. Families and friends reunited, and while the traffic was slow moving at times, people got to where they were going. The Atlantic bubble will remain in place as long as we don't see any spikes when it comes to COVID-19. But clearly, people coming from outside of that bubble, we must know that they have to self-isolate, and we know we have work to do, and we're in the process of ensuring that all of those who come in outside of the Atlantic bubble will be self-isolating within our province. Dr. Strang.
Thank you, Premier. Good afternoon. So let me repeat some of that information. So yes, today we are reporting one new case of COVID-19, which brings the total number of confirmed cases in Nova Scotia to 1,065. And we have currently have 4 active cases in the province. Following contact tracing by Prince Edward Island related to their new COVID-19 cases, we were notified on Saturday that one of those individuals in PEI had been in close contact with someone who had recently traveled into Nova Scotia from the United States and was still here in Nova Scotia. We contacted that individual on Saturday and arranged testing, and their result came back yesterday, July the 5th, and they were positive for COVID-19. That individual is now being held under the federal authority at their local quarantine facility, which is out at an airport hotel. We are in the process of Nova Scotia Public Health of doing all the contact tracing to understand where that person may have been between the June 26th when he came into the province and July 4th when he came to our attention. And we're continuing to work closely with our colleagues in both Prince Edward Island and the federal government as we follow up all these linked cases. As I said, this individual remains within the authority under the Federal Quarantine Act because they're within the 14 days of entering Canada. And so we'll continue to work with our federal colleagues around this case. We'll as we get more information on contacts, we may have to come back and do any public notification, but we don't have any conclusive information at this point. We know that in the last 24 hours that our microbiology lab at the QE2 Health Sciences Centre tested 178 Nova Scotians. That's typical. We see less testing on the weekend, especially on a Sunday. We still have no licensed long-term care homes in Nova Scotia with active cases of COVID-19, which remains good news. Our total numbers, we've had 55,113 Nova Scotians tested with negative results, and 63 Nova Scotians have died from COVID-19. As I said last week, that as we opened up in the Atlantic bubble, that I was comfortable saying there was no greater risk if I traveled to another Atlantic province than if I traveled within Nova Scotia. I'm very comfortable with that statement. I know that people are concerned, though, however, about COVID-19 being brought in here from other provinces outside the Atlantic provinces or from countries from around the world. I understand that is our greatest risk, and that's why we need to understand what is in place at the border and what we're actively working on to strengthen those approaches. People need to understand that our international border is governed by the federal government and Canadian Border Services agencies. It's clear that in my conversation with them on Friday, they reiterated that Canadian citizens and permanent residents of Canada are legally allowed and have to be allowed to return back to Canada. That there are people from other countries that have immediate family members who are either Canadian citizens or permanent residents are also allowed to come to be with their immediate family. And there are some people who have jobs that make it necessary for them to come into Canada, even if they're from another country, such as diplomats. And then we have a small number of classification of essential workers that are allowed to move back and forth across our borders, particularly with the United States. And that's pertaining to the movement of essential goods and services that we all rely on, for instance, to have the food in our grocery stores, et cetera. However, under the Federal Quarantine Act, unless exempted for people such as the essential workers, any of the people, even if they're legally allowed to come to Canada, have to undergo a 14-day quarantine period. Certainly the case this weekend raises questions about people following those rules, and you heard the Premier speak about that, about how it's essential that people are relying on, we rely on people to follow those rules. But I also ask people to not make assumptions about what they may be seeing people doing. If you see American license plates, don't assume that the people are here illegally and that they haven't done their quarantine period. They may be there. Certainly, there's lots of reasons why people driving cars with American license plates can legally be here in Canada. There may be a Canadian resident coming back, and they may have done their quarantine period. The same when you see license plates from other parts of Canada. I think it's important that we don't jump to conclusions and make negative assumptions about people. It's important that people know, as the Premier's outlined, that we're urgently working on implementing a tracking system for people coming into Nova Scotia from outside the Atlantic region, and we'll have more news on that very soon. But I've been on calls all today around around the details of, and so there's a lot of people working very quickly to get that up and going. But I would ask Nova Scotians that if they see people that are here from outside of the province, be welcoming to them, talk to them respectfully about the public health rules that are in place for everybody who's here in the province, and it's important that we make sure that we're doing what we need to do before we look negatively at somebody else who we make assumptions about what they may or may not be doing. As I've said repeatedly, and the Premier said here at these briefings, that reopening our economy and society during this pandemic remains a complex balancing act. On the one hand, people do need to work. We need to have businesses opening and operating, and all of us need some form of social interaction and to be able to get together with each other. And if we have family members in other parts of the Atlantic Canada, it's important that we're able to get to see them. On the other hand, even with all these safety precautions that businesses, workplaces, and individuals are putting in place, this reopening does inherently bring an increased risk of COVID-19. We have to understand that. Again, it's this balancing that we have to open things up, which allows some risk. The way we control that risk we really have two options. We either shut things down again, which is not really an option that anybody wants or is really feasible or realistic, or we all follow the basic public health measures that we've used since March that allowed us to flatten the curve. We need to continue to practice those. I keep saying here, but I'll keep saying it again, we can't relax. It's not about going back to normal, which we were pre-COVID. We have to continue to be vigilant, and we rely on each of us to practice these basic preventive measures. That's what allows us to protect each other and allows us to continue to open things up and do that safely. We don't want to shut down again, but if we don't do a better job of all following these public health measures, we may end up in that situation. So we need everybody to continue to practice good hand hygiene, cough etiquette, staying home when they're sick, and most importantly, when we're out and about, maintaining that physical distancing wherever possible. And if it's not feasible to be sure about that, everybody wearing a non-medical mask. It's most important that any of our indoor environments, so if you're going into a grocery store, any kind of an indoor retail space, if you're going into a medical clinic or a hair salon, all of those are indoor environments where it's not necessarily going to be possible to be assured that you're maintaining that 6-foot distance. So we really need people to start to wear a non-medical mask in these indoor environments when other people are around. When you leave home, you should have a mask with you. Make sure it's ready and available, that if you do need to use it. So if you're going, you have it in your purse or in your pocket, and before you go into a store, or before you get on a bus, before you go inside and drop your child off at daycare, those are places you should always put your mask on before you get potentially close interaction with other people in our communities. While the mask does protect other people, it'll also protect you in the long run. By wearing a mask, you're setting an example that masks are the norm, that we all need to be wearing masks, and as more and more people adopt that, we each start to protect each other. So ultimately, you wearing a mask sets an example, and other people start wearing a mask, and by them wearing a mask, they are protecting you. So it protects each other, but ultimately, what you do sets an example that allows other people to follow that, which then protects you. So I'm asking and I'm appealing to all Nova Scotians, whether it's individuals, families, business owners, employers, and employees. Please take this seriously. We need to continue to do all these public health measures, but the one thing we can do a much better job on is wearing non-medical masks when it's necessary. And again, all those indoor environments, when you're in public spaces that are indoors, when you're in workplaces where you can't be, certain workplaces you just have to be close around other people for prolonged periods of times. And when we go to gatherings where there's large numbers of people, whether it's indoors or outdoors, all of those are places where it's critically important that we start to do much better job of all of us having a mask available and wearing it. It's important that we normalize this as quickly as possible before the second wave of COVID arrives. Once it's here, it'll be too late for us to get our mask wearing to the point where it needs to be. We need to adopt this now as a precautionary preventive measure as we move through the summer and prepare for a possible second wave in the fall. And the same goes for physical distancing. It's that combination of physical distancing and mask wearing, which are the most important. It's important we do everything, but those are the critical ones that will help us to control the spread of any COVID that comes into the province. We control its spread if we're following all these practices and keep them as sporadic, isolated cases. I certainly appreciate that people are anxious just to be able to get out and about, but and not have to worry about all these things. But that is part of our new normal. We have to respect COVID and do what we can to minimize the chance of a substantive resurgence, even whether it's in the summer or as we expect a second wave in the fall. Just want to, again, I'll finish off by reminding people that in our healthcare system, we're still maintaining capacity, and we're focused on ensuring that we have adequate access to anywhere in the province, to timely access to testing, enough capacity in the laboratory, and we're working to ensure we have the appropriate public health capacity for urgent follow-up. So the health system is geared up and doing the things that we need to do to protect the health of Nova Scotians. We need all Nova Scotians to do their part as well, and it's those combinations of the health system, we're rapidly detecting and following up cases, and everybody doing the personal prevention measures, that those two key pieces together are what's going to allow us to move forward and remain as open as we can. Premier.
Thank you, Dr. Strang. We'll be happy to answer any questions now.
Just a reminder, one question and one follow-up for those reporters on the line. And we'll start today with Jesse Thomas with Global.
Thank you. I'm just wondering, with this reaction to maybe a situation of maybe a lax border, do we know how this traveler slipped through the border, and are we confident that this new measure that's being put in place would have stopped this individual?
So I wouldn't use the term slip through the border. He was legally allowed to enter into Canada. That's under federal jurisdiction on who they create who can get in legally. He was legally allowed to get on a plane and flew here to Halifax. What didn't happen is he didn't follow the requirement for a 14-day isolation period. We understand that the federal government takes certain steps to try to maintain or monitor people in that 14-day period. What we're really understanding is that we need to do more within the province. So as the Premier has said and as I've said, we're rapidly putting steps in place. So there'll now be a process of people coming into Nova Scotia from outside of Atlantic Canada or outside of Canada will start to be monitored on a daily basis with phone calls by provincial officials.
Jesse, go ahead with your follow-up.
Thank you. Dr. Strang, you mentioned that you're having further maybe consultations or conversations about the border. Are you looking to increase any other measures to make sure that people are, being truthful and following the public health guidelines? What's next?
So what we've been focused on is in the last 24, 48 hours is developing. So we're going to have information. So people who want to come here will be expected to fill out a form collecting basic information, so we can make sure we can contact them. As they come into Nova Scotia, they'll have to provide proof that they've actually filled out that form, and then they will be and they need to understand. They'll be given information, and they'll be actually have to sign, show that they've actually read and understood the information, and give a declaration that they've read the information of what actually a 14-day isolation period requires. It means going to a place immediately and staying there for 14 days. And then they'll be made fully aware that they're going to be monitored on a daily basis through phone calls. They'll be made aware of the consequences if they're not available, and ultimately the type of penalties that would potentially they might face if they're not in compliance.
That data, just to follow up with Dr. Strang, the form will be ready for tomorrow, but that information is being collected today at the border from anyone outside of the Atlantic bubble.
Next question will go to Natasha Pace with CTV.
Hello. Premier mentioned that the form will be available tomorrow for folks entering Nova Scotia from outside of the Atlantic bubble. New Brunswick and PEI had forms ready to go before the bubble opened. I'm wondering whether or not you feel like perhaps we dropped the ball on this particular thing, and what type of penalty will the individual who didn't isolate face?
So PEI and New Brunswick had been using the form for quite some time. It had nothing to do with the Atlantic bubble. They had coming into their province. What we did from the very beginning is having an information picket really at our border to tell every car that was coming across, including Nova Scotians, because ultimately, if you remember back when we started the issue at our border really was to remind Nova Scotians they had to isolate as well. Early on, our issue was not tourists or travelers coming in. It was actually Nova Scotians coming home who weren't following the public health protocol. And so we started to provide that information at all of the entry points coming into our province. As you know, on the weekend, we had over 10,000 cars crossing that border coming into Nova Scotia. We know less than 700 of them were outside of the Atlantic bubble, some of whom would have been going through our province, potentially to Newfoundland. So we are now, though, continuing to hear reports from communities that people are feeling, that people who have been outside of our province, outside of the Atlantic region, are not following those public health protocols. So we'll take it the next step, which now is we'll gather that information, and then we'll continue to use our 811 system that we were using early on for the testing mechanism. We'll use that now as our base to do those calls and follow up on top of what's already happening.
Natasha, go ahead with your follow-up.
Thank you. Dr. Strang, you spoke a lot on Friday about mask use. You spoke a lot today about mask use, telling folks they should have one when they leave their home and be prepared to wear it to normalize it. But you haven't mandated that yet to make it mandatory that Nova Scotians wear masks indoors when it's not possible to physically distance. Will you be doing that at some point? It seems like a lot of folks aren't following your recommendation and aren't wearing masks. And in particular, are you looking at making it mandatory for people on public transit to wear masks? There was a bus driver this morning who was taken to hospital with COVID symptoms.
So we're certainly looking at, I've said all along that the mandating masks is not off the table. It's certainly that along the continuum of how strong approach we need to take with masks. We need to engage a number of sectors, business, especially retail sectors, malls, et cetera, about what they could do to strengthen their steps that promote and support people wearing masks. And what role does government might have in terms of supplying them with masks. We have a stockpile of masks, but we're certainly also looking at mandatory if necessary down the road. It's part of a suite of things that we're continuing to discuss about how do we strengthen ultimately our approach to make sure masks are used as much as possible.
Next question will go to Mike Gorman with CBC.
Premier, I appreciate that PEI and New Brunswick's screening protocol predated the Atlantic bubble. But given that the whole point of the Atlantic bubble was uniformity and to allow people to pass freely with less concern, why wouldn't we have wanted a similar level of stringent evaluation at our border relative to our neighbors?
We had from the very beginning, as I said to you, we started this actually, was, as I said to your colleague earlier, was really to communicate to Nova Scotians that the public health protocols applied to them as well. We continued to do that. We believed that the information that we were providing, Nova Scotians were following, and people who were coming into our province were following. We certainly, though, have heard from a lot of Nova Scotians, particularly over the last really few days, who are concerned about people coming in and not following that protocol. So we'll take it the next step, which will be requiring that information and data, and we'll use the capacity that we have that we built in our 811 system to make those calls.
Mike, go ahead with your follow-up.
Premier, you said last week that we won't be turning anyone around at the border. We are where we are today in part because PEI did just that. They turned someone away who they deemed was not qualified to come into the province. And so are you prepared at this point to change your position on denying entry to Nova Scotia to people from outside Atlantic Canada who do not satisfy this new criteria that you have announced?
I believe, I don't know who you're referring to. I believe the person you're talking about is the person in quarantine who actually is a student visa to go to school in Prince Edward Island. The reason he was turned away at the border, my understanding was he didn't have the form filled out. So he came back here to fill out the form to go back. So that's part of the misinformation that's associated with what's happened. But we have continued to say that, and we have never closed our border. People were allowed to come in. We expect them to follow the public health protocols. What we have said and continue to say that if you're coming in for less than 2 weeks outside of the Atlantic bubble, it doesn't make a lot of sense to come into Nova Scotia because you're going to be quarantined. You're going to be self-isolating for those 14 days. So if it's a short stay visit that you're coming, it doesn't make a lot of sense. If you're coming in from outside of the Atlantic bubble, that's the message we'll continue to deliver and the one we have been delivering.
Next question will go to John McPhee with the Chronicle Herald.
Thank you. This is a question for either Dr. Strang or the Premier. Would we have known about this person from the United States if PEI had not told us? And how did that conversation, that contact from PEI this weekend take place?
So that was communicated. I got a phone call from my colleague and counterpart in Dr. Morrison in PEI. Their epidemiologist had also been in touch with our epidemiologist following the normal protocols of how we transfer information between provinces when there's shared cases and follow-up information. But Dr. Morrison also, knowing the urgency of this, gave me a call as well. If this person hadn't had that contact, that's we may not have come to our attention. That's part of one of the issues that we've had, as we've learned from this case about the follow-up from a federal perspective, and why we're then a key issue of why we're then moving to strengthen the provincial monitoring on to a daily basis on follow-up for all these people that enter the province. One of the purposes of that follow-up would be it's to make sure that they are quarantining, but it's also to check in with them and make sure they're aware of what to do if they do get sick.
John, go ahead with your follow-up.
Thank you. This is for Dr. Strang. You mentioned that besides the declaration form that will come out tomorrow, there will be a tracking system put in place for people coming into the province from outside the Atlantic region. Do we know what that's going to look like and when it will be put in place?
Well, that's actively working as well. That's all part of that data collection. The purpose of that data collection is to have that information fed to the people who are doing the phone calls. So there are information, IT specialists who are working on that right now, all the details to make that flow of information from the form that somebody fills in to the people who are actually going to be phoning that individual, that family on a daily basis with the information that's on that form. So we're working through all the details around that.
Next question will go to Brian Flynn with All Nova Scotia. Brian, you on the line?
Hi, Yes, I am. Sorry. Hi, Dr. Strang. I'm wondering, with people entering Nova Scotia in larger numbers than we've seen in months, how important is it for contact tracing for the province to track the names and the contact information of visitors? And are you concerned that since this hasn't been happening the past few days, that makes Nova Scotians vulnerable?
So I think what we've seen in the we've had 4 cases in the last week. 3 of those 4 cases, the appropriate steps have been taken by individuals to make sure that they were adhering to their quarantine. And we've had a number of other cases in the last few months around COVID-19 where we've had people tested positive and they have been adhering to the quarantine requirements. So I think we have to remember that the vast majority of people have been fully and anticipate we'll continue to do that. But I think what we're seeing, based on the cases, based on where we're at now with Nova Scotia, one of the critical things we need to do is make sure that we're aware of any COVID that's the potential for COVID-19 to be brought into Nova Scotia. That's why we're putting in place this strengthened collection of information and then follow-up monitoring and people coming from outside of Atlantic Canada into Nova Scotia. It's all about making sure that people are adhering to the quarantine, so if they do get ill, they haven't been exposing large numbers of people.
Brian, go ahead with your follow-up.
Sure. Dr. Strang, how many days was this person not self-isolating in Nova Scotia? Where did they go during that time, and how many people potentially came in contact with them?
That's all the work we're doing right now in terms of that contact tracing. Working with that individual, the understanding they came in here on the 26th. The people from PEI came to pick them up. They went to PEI, weren't able to do that, and then came back to Halifax. So that's all the contact tracing we're doing right now. From the time they came back to Halifax to Saturday, where were they, what they were doing, and who might have been in contact, who might they have a close contact with, and then following up all those individuals. I don't have exact numbers. As I said, that's active work happening yesterday and today by NSHA Public Health.
Next question will go to Margot with Radio Canada.
My questions have been asked. Thank you.
Next question will go to Tim Biscay with Halifax Examiner.
Hi, thank you. I recognize that there's different levels of government here, so. But I wonder if you might speak to the issue of planes, especially as we're contemplating going into moving the Atlantic bubble to a Canadian bubble. We have Americans coming into the allowed airports, Toronto, say, and then they just get on other planes to come to Halifax. Shouldn't they be doing the self-isolating at the airport of arrival and then waiting to get on another plane, because everyone else on that other plane will be effectively within the Canadian bubble when that is created?
So those have been topics of discussion, with my colleagues, with our federal counterparts. They're under federal jurisdiction and making those rules. I think you can understand the logistics of holding. They've limited to a handful of airports international arrivals. So the logistics of holding hundreds, if not thousands, of people at those the 3 or 4 large cities are challenging. I also have to remember that the vast majority of these people are well, and so the decision was made to allow them. If somebody's symptomatic, they are absolutely identified at the point of entry and held there. But if they're well, they're allowed to move on, and there are certainly federal processes in place to monitor them. But certainly we need to, as we've talked about, we need to strengthen the provincial monitoring as well.
Tim, go ahead with your follow-up.
Yeah, I recognize that you're strengthening that, but I have many people have contacted me to say that they have flown into Halifax and there was essentially no contact with any people telling them to self-isolate. As somebody put it to me today, there was a table with pamphlets on it that everyone ignored. Do you feel like this was a failure?
I'm not sure what you're referring to as a failure. I mean, we've had certain steps in place at our borders, whether it's the land border or the airport, and we're taking steps to strengthen those.
And I think it's important at the national level, there are 4 airports in the country where you fly into: Toronto, Montreal, Calgary, and Vancouver, where if you are outside of the country, whether it's coming from the U.S. or from Europe, you go through those airports, and it is Canada Border Service Agency that would be dealing with you, allowing you access or not into Canada. The issue becomes, in many cases, if you follow the restriction, the closure of the U.S. border, it's really non-essential travel is actually not allowed coming in out of the U.S. You are getting Canadians who are working in the U.S. or who have been in the U.S. coming home with Canadian passports, or you have others who have the ability, as Dr. Strang talked about earlier, crossing the border. But they have to clear Canada Border Service Agency in any one of those 4 airports. That's why the national government moved international flights into 4 areas as opposed to what was happening before. And then, of course, you're looking at the domestic travel that is happening. We've had people at our airport, and as we have at all of our border crossings, to continue to provide. I don't know exactly who and when this person would have come in, but I've had lots of calls from people who have come in through any one of our entry points, including the airport, who have talked about the fact they appreciated being greeted by Nova Scotia employees who were providing that information and telling them they needed to follow the public health protocols, and here's what they are.
Next question will go to Ed Halverson with QCCR Radio in Liverpool.
I think it's in line with Tim's question, actually. Over the weekend, it was reported a man decided not to board a flight to Newfoundland, Nova Scotia, flying to Newfoundland, out of concern that the other passengers were all flying in from points outside the Atlantic bubble. Will people traveling within the Atlantic bubble have to self-isolate at any point for 14 days if they are traveling on a flight with passengers who's working from outside Atlantic Canada into the bubble?
No, they're not going to have to. We have to understand that even though people have concerns about airplanes and air flight, and it brings people closer together on a flight, we've seen the epidemiology of COVID-19 that traveling on the actual travel on an airplane has not created substantive risks and transmission of COVID-19. Having said that, I would encourage that certainly a place where wearing a mask is vitally important, whether you're in the airport terminus or whether you're on the plane, because that's a perfect example of where you're going to be around lots of other people and you may not be able to maintain that physical distance. So everybody on a plane should be wearing a mask, being very careful with hand washing, having alcohol wipes, wiping down the drop-down table on your seat. All those measures are really important to maintain on a plane. But we actually know that there's not a substantive increased risk through plane travel. So we would not be requiring somebody, the example you've given of somebody who just happens to be on a plane, their own travel is within the Atlantic provinces. They wouldn't have to do a 14-day isolation period.
Ed, do you have a follow-up?
Yes. We've seen that people are sensitive about having put on a mask. Dr. Strang, you've highly recommended this. Are there any concerns that if by mandating masks, you'd be impinging on people's charter rights?
So everything. I mean, there's lots of examples of where governments by necessity to protect our collective good, that we put restrictions on people's individual rights. So we need to think about this carefully, but absolutely, if there's a necessity to mandate masks, if we're not able to get to where we need to be with less I guess stringent measures, that's something we would need to look at. And clearly, there's precedent that we could do this from a legal perspective. We always have to make sure, though, however, we're accommodating. There are small numbers of people that cannot wear masks, whether they have a legitimate medical reason, or there's certainly people with especially developmental disabilities who their ability to tolerate, they just cannot tolerate wearing a mask. So, but we will have small numbers of people in our community that cannot wear a mask. But if the vast majority of us are wearing masks, we're all collectively, providing a level of safety for everybody, including those small numbers who could not wear a mask themselves.
Next question will go to Bill Martin with Six Rivers News.
A question for the Premier. I don't want to assume anything, Premier, but I had a sense in your opening remarks that there was either some anger or consternation in your voice. I just wonder about that, and wonder if you think maybe we're rolling the dice when it comes to trusting people to do their self-isolation after such instances.
So, maybe you might have sensed a bit of frustration. I think all of us have worked very hard to ensure that we followed the public health protocols. Let's go back to the very beginning. If you remember, a lot of Nova Scotians weren't following the public health advice when we started this journey of COVID-19. We came out, that's why we put the information pickets up. You might remember the phrase "Stay the Blazes Home" was sent to try to communicate how serious this was. And I want to thank all of those Nova Scotians who have worked very hard. They are frustrated. We are frustrated that people coming in from outside of the Atlantic bubble feel that some, I shouldn't say not all, feel that these rules don't apply. And it's certainly causing some concern in some of our communities. And I wanted people to fully understand. We've heard them. We will work very hard ensuring that we track those people coming into our province and ensuring that they are following the public health protocol set out by Dr. Strang.
Bill, do you have a follow-up?
Yes, thank you. Premier, once again, last week you told us that people crossing the border to New Brunswick, from New Brunswick, were being asked about how long they were staying and where, etc. And you said then that if they were staying less than 2 weeks, you were advising them to turn around and go back. Today you're suggesting there's a lack of wisdom in continuing on to spend less than 2 weeks in the province. We also learned on the weekend with the busy traffic that the people manning the borders from the conservation community are perhaps not even empowered to make people turn around. What really is the case?
So they would. We don't have law enforcement at our borders. Let me be clear about that. Nor have we given the people on the border extra powers. What we have said, and I've said this many, many times at our border, we continue to communicate what are the public health protocols and what the expectation is of our province when you come in into this province, no matter who you are, when you were self-isolating prior to the Atlantic bubble. What we're saying, and we're continuing to say that, and I've said before that if you were coming in for less than 2 weeks, it didn't make a lot of sense to come into a place where you're going to have to spend 14 days in isolation unless you were coming for a period of time, like the summer. It just didn't make any sense, and that's what we would be communicating to that. And we do know of some people who actually did turn around and not come in from reports that we have seen over the last number of months based on that on those 14 days. But what we've seen this weekend, as you would have, as you know from down that way, we had a large volume of traffic coming across the border. We continued this weekend to communicate the message of the self-isolation. We were trying to move cars through there. Over the last number of days, I think would have seen yesterday and today, traffic moving much more smoothly on our side of that border coming through. And now what we're seeing is those officers do have the ability to ask all of the adults in cars that are outside of the Atlantic bubble, where are they going, what's the address they're going to, and where is a contact number that we can get a hold of them for 24 hours a day, 7 days a week. That will be what the form will say tomorrow that people will be able to download, and we'll use that form and the information collected today to start making those calls to ensuring that people are following the public health advice and protocols that have been set in place.
That's all the time that we have for questions today.
Thank you, Christine. Thank all of you for the questions. We understand there are lots of concerns about people coming in from outside of the Atlantic bubble and not self-isolating, and we have heard you. But we can't lose sight of the positive either. We opened ourselves up to our Atlantic neighbors, and by all accounts, it went well. People saw their loved ones for the first time in 4 months. Friends got to hang out, and families took a road trip. We also welcomed thousands of people from around the region who came in to rediscover Nova Scotia. They ate at restaurants, spent money in our shops, and help support our economy, and this is a good thing. And we are open to the Atlantic bubble because of all of your hard work and sacrifice. I am grateful that Nova Scotians continue to follow the protocol, and I want to reassure you that we are doing everything we can to tighten the border, please know that we've heard you.